Hello, everyone. My name is John Auerbach, and I'm from Trust for America's Health. And welcome to this, the third in a series of webinars that focuses on the importance of communicating during the COVID pandemic. We are going to be focusing on at this webinar on vaccine logistics and distribution messaging. And we're very fortunate to have a number of experts with us today who can help in terms of doing the proper messaging in these challenging times. I want to start by thanking our funders again. They are the CDC Foundation, and particularly want to thank its director, Judy Monroe, the De Beaumont Foundation and its director, Brian Kastucci, and you'll be hearing from him shortly. And then also we have very valued partners, including NACCHO, ASTHO, Big City Health Coalition, HAF, the American Public Health Association, Resolve to Save Lives, and the Robert Wood Johnson Foundation. We're also incredibly fortunate to have as partners GMMB, a nationally renowned communications firm, and you'll be hearing shortly from its Senior Vice President and Managing Director, Tracy Siegel, who's going to be helping us in terms of fielding questions from you during the portion of the webinar when we'll want to engage you more directly in terms of the questions that the panelists are answering. Before beginning, I'll also just mention that we will be sending to all of the participants in this webinar a survey today that will be soliciting additional information from you about possible subjects for future webinars and other resources that can be helpful for you in the work that you're doing, communicating at the state, local, tribal, and territorial levels. Our goal is to be useful to you, to help you do your job in ways that field the challenging communications issues that are coming up and changing continually. So let's talk for a minute about the agenda. We're going to be hearing initially from Dr. Kastucci from the De Beaumont Foundation, and he's going to be presenting some fascinating information about vaccine language polling, and from a recent poll that produced findings about how best to do messaging around vaccines. We're then going to hear about misinformation resources and get a brief review of the misinformation resources that are available in the public goods projects and get some general practices about addressing misinformation as related to COVID-19 vaccines. That presentation is going to be made by Dr. Joe Smizer. He's the CEO of the Public Good Project, which is, by the way, a nonprofit organization that designs and implements large-scale behavioral change programs for the public good. We refer to that as PGP. And Dr. Smizer's academic background is in public health. He's got a PhD and a master's in public health, and he's worked as well at the Centers for Disease Control, where he focused on evaluation. So we're looking forward to hearing from you, Dr. Smizer. Then we're going to have questions and answers. We're going to pose some initial questions and answers some initial questions that came from people who pre-registered for this webinar. And we're going to pose those questions to Dr. Smizer and also to Dr. Nadine Gracia. Dr. Gracia is the Executive Vice President and Chief Operating Officer at Trust for America's Health. And Dr. Gracia served in the Obama administration as the Deputy Assistant Secretary for Minority Health in the Department of Health and Human Services. And she also led the Federal Office of Minority Health. And previously to that, she was the Chief Medical Officer in the Office of the Assistant Secretary for Health. So we've got some real experts in terms of dealing with COVID and thinking about the challenging communication issues that arise. Now, following the questions that we've already received from you that we'll be posing to our two panelists, we are then going to open things up for you and ask you to submit questions via the chat function. So we'll give you plenty of time for that. But please, as you're hearing the questions we're posing initially to Drs. Gracia and Smizer, begin to think about the kind of questions you would want to ask. And in particular, we want questions you're being asked by the media or by members of the public, because, again, our purpose here is to be useful for you. So with that said, let me say one final thing, again, before turning things over to Dr. Kastucci, and that is this webinar is being recorded, and we're going to make that recording available to everybody who's on the webinar. So if you don't need to worry about taking notes. If you want to have a copy of the information that's being shared, we'll make that available to you in the coming days. So with that, it is my pleasure now to turn things over to Dr. Brian Kastucci from the de Beaumont Foundation. Brian?
I think the riots of the past week at our nation's capital stand really as a monument to the power of words. When misused, as they were this past week, words can confuse, divide, incite, and kill. But history has taught us that words also have the power to inform, inspire, unite, and protect. And that's really why we chose to do this vaccine language poll. Next slide, please. So we worked with pollster Frank Luntz to conduct a poll that oversampled people of color and was representative of the nation so that we could really understand specific words, sentences, phrases, things that would help people make the right choice, words to inspire people to do the things that we need them to do so that we can get back to normal or a new normal post the pandemic. And so where other polls have really focused on identifying attitudes or perceptions, this is really about language and things that motivate people to action. Next slide, please. So just to really go over some of the top-level findings, there are really 4 takeaways for me from our poll. First, we really have to personalize our messages about the vaccine. It's not about a duty to country. It's not about the right thing to do. It's really about protecting your family and yourself. That's what people are moving. That's what's motivating people and helping with vaccine confidence. Because ultimately, our ability to get through the pandemic hinges on our ability to engender increased vaccine confidence among the public. And by making it personal, it can help do that. That's one. Secondly, we have to stay positive. We need to make sure that we're talking about the benefits of taking the vaccine, not about the consequences of not. So when Frank and I have talked about this, he talks about it like an Oreo cookie, where the chocolate wafer part would be the positive, and whatever that stuff is in the middle, the alleged cream, that would be the negative. And so start positive and maybe say, we can get back to normal. If we don't take the vaccine, there could be more death. But ultimately, if we do take the vaccine, you'll be able to resume, your activities before the pandemic. Really start and end on a positive. That's third. That's second. Thirdly, we need to stop judging. We started very early in the conversation around the vaccine, talking about those who are vaccine hesitant. Hesitancy can sound judgmental. It doesn't necessarily open up conversation. We need to normalize the idea that people are concerned and people are skeptical of this vaccine. But approaching someone with, I understand that you may have concerns, what are your questions and how can I answer them? That's something that resonates better with people than being told you are hesitant. And lastly, we're going to have to tailor some of our messaging. And it's not now some of the things that the 3 previous ideas here definitely resonate across all groups, but we are going to have to find those hooks within groups that appeal to them. Let's take, for example, 18 to 49-year-old Republicans. They really do care about getting back to normal and a start to the economy. So your messaging to them is about saving lives and returning to normal and getting the economy going. And then, ultimately, we're trying to increase confidence in a vaccine, much like Coca-Cola wants us to desire a Diet Coke or a Coke, right? We're trying to sell. And so using some of this language will help us sell the vaccine. We have to make sure that we're bringing as much confidence to the public as possible. There are going to be people who are not going to hear any of it, and that's okay. I wouldn't devote a whole lot of time to those who are just simply recalcitrant. But for those who are open to hear and open to education and open to hearing from family and friends, which I think is one of the most important things we found in our poll and found in other polls, is that this is not going to be a moment where Elvis takes the polio vaccine and everyone says that's a great idea. It's going to be friends and family who are going to be the best ambassadors for confidence that we have. And so there may be a way that health leaders bring people in the community together who are interested in pushing out vaccine, pro-vaccine messaging and arm them with the right words so that they can be effective when talking to family and friends. But this is the time not to fight about the vaccine. It's a time not to judge and stay positive and try to, encourage confidence and uptake as best we can. Next slide. So this was only a brief overview. There are, a plethora of tools at debeaumont.org/COVID-vaccine-poll. We will continue to update this site with language tips and other things as we get them. Would also encourage everyone to check out phrases.org as just a really good kind of primer in how to talk to people from other sectors about public health. So that was just a brief overview. Mark Miller at debeaumont.org and myself at Kastucci at debeaumont.org are always here to answer questions and help as best we can. With that, I want to turn it over to Dr. Joe Smizer, who is going to be talking about some very exciting misinformation resources, including some misinformation outbreak alerts. So, Joe, I'm excited to hear about it.
Thanks, Dr. Kastucci. We can go ahead and I think move on to the next slide. Thank you. What you're looking at here is the result of a lot of really innovative work. When PGP came on board to assist the Public Health Communications Collaborative, it was an exciting opportunity for us because we immediately saw the value of this collaborative. The way that we have jumped on board to help is part of what PGP does is it collects all publicly available media data. So that's traditional media like television and newspapers and magazines, and then digital media like websites, video, online video, and social media. All of that data gets brought in, and if you saw the special on us on the way that we've been working during this pandemic on NBC News with Lester Holt, there's an emergency operations center that's set up. It's staffed by about 10 people, most of whom have an MPH, and they are going through this data aided by machine learning and natural language processing and categorizing all the misinformation that's circulating through all of these media sources across the United States and by state, and then synthesizing all of that misinformation into an easy to understand format for people who work in public health. And that's what we are bringing to bear for the PHCC. And in a couple slides, you'll see the domain on PHCC's website. That's updated every single week. So we're collecting this data and processing it and contextualizing it 24 hours a day, 7 days a week. These are people's full-time jobs now. But when you bring on all the data, it's from January 1st until January 12th, it's organizing itself as kind of, you can see here into these themes. This is specific to vaccine misinformation, but overwhelmingly what the public is concerned about right now, which of course is really different than pre-pandemic, is COVID-19. So all the misinformation circulating around vaccines is pretty specific to COVID-19 vaccines. And then you see as you go down the list here, and this fluctuates hour by hour and day by day, but generally this holds true. This sort of reflects people's interest in topics of vaccines and the misinformation and disinformation that's created and circulates through offline and online social networks. If you go to the next slide, this gives you an example of the fluctuations day by day. And these are driven by spikes in a particular piece of misinformation that starts to circulate, driving a particular narrative, and that narrative does go viral. So it might start in a private Facebook group, but then it spreads everywhere else. It might start on Twitter. It might start offline by something a politician says on camera, for example, or in a meeting, and then it goes into social media. It's a complicated process, and a lot of organizations are spending a lot of time doing this. But again, this effort that you're looking at and we're talking about today is specifically for public health professionals in particular. And if you go to the next slide, this is just an example of some of the things that you can pull from this data. This was pulled this morning. And if you're looking at hashtags used on social media that are highly correlated with misinformation, these are those hashtags. So if you dig into these hashtags and you explore different types of media data, you can really quickly come up with the major sources of misinformation and the major pieces of misinformation that are circulating through the United States at any given moment. If you go to the next slide. And this is what it looks like if you go to publichealthcollaborative.org/misinformation. What we've done here with leadership at PHCC is we are, again, explaining what is circulating right now, what do you need to know about it, here's the fact check, here's the link to the fact check, and then here is our recommendation for someone in public health, whether to ignore it, to respond in a particular way, perhaps by updating an FAQ section on a website, for example, or just being ready if you're directly asked by a member of the public, or directly respond as in you should create communications and directly respond to this misinformation because it's at that level. And so we're trying to do all that work for you, again, working with all of our colleagues at PHCC, and this is updated once a week, and it goes out through PHCC's newsletter as well as being live on the website. So it's a Herculean effort, but we're all behind it, and it will continue to evolve as the pandemic evolves. And we are very interested if any of you have recommendations or thoughts about how we can make this better, because this is just a tool for public health by public health. And I think we can wrap up there.
Thank you, Joe. And this is Melissa Morales. I will jump in here. I'm with the GMNB team, and together with John, we'll help transition us to our Q&A session. If we can go to the next slide. So as we mentioned earlier, we will kick things off with some of the questions that many of you had submitted prior to the webinar. Thank you for those. But when we do transition to open up the floor, we will invite folks to share their question, and for that reason, we ask everyone right now to please keep your microphones muted. We'll first answer those questions that were submitted, but you can, at any time, submit questions that you have through the chat to all panelists. So via the chat function, feel free to submit questions. And once we get through those originally submitted questions, we will turn to those that have been submitted through the chat. And if your question is selected, we will ask you to unmute yourself and ask your question. All right. So with that, I'll turn it back over to John to lead us through the first set of questions that we've received.
Presentations that they made, and remind you that you'll be able to get those slides with the recording, and you can always go to the Public Health Communications Collaborative website and find the kind of information that you've seen in those presentations. So now we're going to jump in to questions that you've submitted already and begin to talk about what the content should be as you're grappling with those questions. And as you're hearing the initial questions that will appear on the screen, do continue to submit questions as you just heard, and we're seeing lots of questions coming in, so that's terrific. So welcome again, Dr. Gracia and Dr. Smizer. Okay, I'm going to start with the first question, and this is one that has been in the news a lot in the last week or so, and that is related to the fact that the number of vaccines being administered, the number of shots being given out, is much lower than what was anticipated. There was an anticipation, I think, of 20 million doses being administered by the end of December, and that didn't happen. So how do you answer the question that is coming up from media and also people in the public of how do you explain this shortfall, particularly to members of the public? Dr. Gracia, would you like to begin?
Sure. Thank you, John. And let me first say greetings to everyone. It's really a pleasure to be here with all of you. And I want to thank all of the audience members just being on the front lines of public health, how critical and vital you are to supporting and advancing the nation's health. And I don't think that we can thank you enough. So I wanted to start there. Certainly, this is indeed a question that's being asked regularly. I think is an important one. And I think some approaches in responding to a question such as this is really understanding the magnitude of what is being undertaken. That first, the distribution of a new vaccine to the entire population really is an undertaking that we have not experienced before as a nation, and that it requires, as you well know, the coordination at many levels, the federal, state, local, tribal, and territorial levels, and that there have been some administration challenges when you think about the administration of these vaccines in particular with regards to the cold storage that is required, as well as the distribution systems. And I think that, public health experts have noted that there has been insufficient coordination in the multiple levels that are involved, where certainly at the federal level through the Operation Warp Speed program, you had the focus on the vaccine development, but that there needed to be as well the attention and resources and funding and planning for the distribution and administration. And so really communicating that and understanding those components of distribution to administration. And we're now starting to see actually increases with regards to the administration of the vaccine is very important. And certainly as funding is getting to states and localities, which is critical. States and localities have to have the funding to be able to actually administer the vaccines, have vaccination sites, provide the resources to communities. That's going to start to continue to increase. But really being able to be transparent in why some of those challenges and delays have been happening, I think are helpful to really informing the public.
That's great. Thank you, Dr. Gracia. Dr. Smizer, anything you would add to that?
I thought that was a great answer. The only thing I perhaps would add is just to second that clear, consistent updates to the public is required. CDC has a press room that is designed specifically for public health emergencies, which this certainly qualifies as. I don't remember ever having seen an update from CDC's press room during this pandemic. It's designed to accommodate members, reporters, members of the press. I think what we also need to see is the shift from people whose job it was to develop the vaccines and figure out how to put them in and out of boxes, freezer boxes. We need to stop talking about that part, and we need to start talking to people whose job is actually vaccinating. There's a really big difference between creating vaccines and getting vaccines into somebody's arm. And that's where we're at now. So we need community leaders, we need community organizations, we need local public health officials supporting the federal government, not the other way around. That's all I have.
Great. Well, thank you. Now, I neglected when I began this session, I neglected to mention that this section is going to be moderated by Brian Kastucci as well as by myself. Brian is very skilled at answering challenging questions from the media. And Brian, anything you'd add to this question?
I think it's about understanding, and I think it's okay to say we understand that you're frustrated. We're frustrated too. What's really important right now is to make sure when the vaccine's available to us, that we are ready to take it so that we can get back to normal, get our economy going, and keep our families safe. There's nothing that many of us can do to change how the rollout is going. So in some ways, it's screaming into the wind. So instead of screaming into the wind, find a way to fly a kite.
Thank you. So let's move on to the second question. So this is related to that question, I think, and that is that we've got a limited supply of vaccines, and so one of the challenging questions is about prioritization and again, groups. How to answer the questions regarding who should be vaccinated first, and that's something of a controversial question. I'll open that up to any of the three of you. Who would like to say how you would answer that kind of question?
Well, I'm happy to start. I think, again, having that kind of clear communication, again, that's transparent, and that also is helping to provide clarity so that it manages expectations of when would we be eligible and able to receive the vaccine. It's really helpful to informing communities and informing the public. I think as we talk about the rollout of distribution and administration of the vaccine, it's helpful to indicate that, with the distribution and administration of vaccine, with any vaccine, that initially the supply is limited. And so what we're doing is prioritizing those individuals who are at greatest risk, for example, of exposure and contracting the virus, as well as individuals who are at greatest risk of developing severe illness and poor health outcomes from the virus, and that as more of the vaccine becomes available, then the goal certainly is to have more and more people that are being vaccinated. And so explain that prioritization, that's why starting with healthcare workers, right, who certainly are on the front lines, have a great risk of exposure, and that are needed to be able to provide care for people who are getting sick from COVID-19 is critical, as well as to the long-term care, residents of long-term care who are identified in that 1A group. And recognizing that people will have questions then when does that mean we would then be prioritized, and really being clear, understanding why those prioritizations are being made so that we can help to really gain control and to stop the pandemic.
And I think it's super important to watch in your local communities if there are any stories where people are skipping the line, right? I think people are often okay waiting in line until they see people cutting in front of them. And then they want to know, why did they cut in front of me? And so, I try to make sure that I'm watching all news channels. So I watch CNN, MSNBC, Fox. I try to hear what the different narratives are so that I'm ready to counter those narratives. And if, don't let one person who got the vaccine because someone's about to throw it away and just happen to give it to this one person, don't let that disrupt all the good work of the scientists and the leaders who have really helped us answer a hard question about vaccine prioritization. There is no right answer, but we've kind of brought the best science and decision making to bear to come up with a prioritization list that works for our country.
So I would just say this issue also raises, I think, a communication question, which is how do you expressing a public health message when the information you're delivering could change at any minute? Because I think a number of public health folks were explaining, okay, 1A from the CDC's 1A category, healthcare workers and nursing home residents would be the priority. But then pretty quickly, different populations are being added to the priority list. I think the federal government just announced those over 65 are eligible. In some places, the states get to make a lot of decisions. So, I just wonder if you all would have any comment about that, or how do you deliver a message well aware that the information you're delivering could change the next day?
How do you say that? Bluntly. I was born and raised in California, so we were used to statewide fires. And nobody is angry at a fire chief when they tell you that the fire has moved in an unpredictable pattern. And that's what I think public health needs to get a little bit better at, which is a big ask right now, because the same people who are tasked with getting vaccines out are the people who are also tasked with contact tracing and every other part of the pandemic. But I think just getting in front of the camera, being humble, but also being an expert, not being afraid of being an expert, and just telling people that this is an evolving situation and we're learning as we're going, but this is why you can trust us, is pretty important. And I think being supported by the federal government is going to make that job a lot easier. Local officials need cover provided by federal talking points that are consistent. And so I think once it starts happening, our jobs should get a lot easier.
And I think to reiterate a point that that Brian made earlier too, is saying we're basing this in the science and the data, right? And that this is a rapidly evolving situation, and recognizing that can feel concerning, but that you're presenting that information in a timely fashion, and to Joe's point, that you're trying to be clear and consistent with what you're saying, but that may change. But that's evidence based on what you're seeing, right? What you're seeing with the medical experts, what the medical researchers are finding, and that what our goal is, again, is to protect health, and to help us get back to help us in getting to normal, or a new normal, if you will.
That's great. Thank you all. Next question. Well, there has been different expectations that have been floated. Some of them be correct about how long it's going to take to get everyone vaccinated. So when there's misinformation floating around about what realistic expectations are and what delays might or might not be, how do you correct that? And Dr. Smicer, why don't we start with you, because you're monitoring all of those the misinformation that's floating on the web. How do you combat that if you're hearing a lot of people sharing information that's just inaccurate, say, about how quickly people can be vaccinated?
Well, what we see in our data is, and this is true not just of pandemic-related information, but all information we've ever monitored, is that the stuff that sticks with people is the stuff that's local and personal. Not the stuff that is talking about what's going on nationally. It's not news that comes out of Washington, D.C. It's stuff that's about where you live. And it's about the people that you know the names of and that you recognize. It's your mayor, it's your fire captain, it's a teacher, it's people like that. So just say, continue to be realistic, honest, and transparent, and I think that will go a long way. I'm very skeptical that everyone's going to be vaccinated by April. I don't think we're going to get herd immunity in 2021 personally. I don't think hope is a strategy. And I think as long as local officials are just being real with people about here's what we know, here's what we don't know, here's the resources we have, here's the day-to-day update as this thing goes on, I think people will be really forgiving. Not everybody, but I think most Americans understand this is an emergency situation, and not everybody has the answers. But I don't think, I disagree a bit with some of the incoming administration. I don't think presenting rosy scenarios to the American public of we're going to have this many things done by this day is a particularly good idea. I think it kind of sets you up for failure. But that's just my personal opinion.
I also think we have to be thoughtful about what we are. We are health leaders. We are not fortune tellers, right? If I could tell the future, I would have, laid the points and taken the over last night in the college football playoff, and I could retire today. But I think we need to be thoughtful and just say to folks, we don't know. We don't know when we're going to be vaccinated by. We don't know if we're going to reach herd immunity. What we do know is that the quickest way for us to get back to normal is taking the vaccine when it becomes available, because that's what we can control, right? And I think I agree with Joe, throwing out, rosy scenarios. I can say right now, I think the Patriots are going to win the Super Bowl next year. And I'm probably going to be wrong, but I can say it, and there's just no value in it. What I can say about the vaccine or what I can say about what's going to happen in the future is that I'm going to do the best that I can and help lead the community to do the best that they can so that we can get through this as quickly as we can.
Next, I'd like to go to the next question because I want to make sure we have time for a lot of the questions that are coming in. This is an evergreen question, let's just say, and that is the continuing discussions about mask wearing and social distancing. People get tired of hearing that message, tired of continuing it, and as they're hearing that vaccinations are occurring, maybe they're going to be less careful about the importance of mask wearing and social distancing. Any thoughts about how to, as vaccinations increase, how to continue to reinforce these messages?
These are all, as everyone often hears, tools in the toolbox, right? That we have been promoting mask wearing and the physical distancing, washing your hands regularly, avoiding crowds. And now we have the COVID-19 vaccine, right? We have 2 vaccines that are authorized for use, and that is adding to the tools to help us really to control it and the pandemic. But as we're noting that not everyone can get vaccinated at the same time. And so recognizing that even in your own family, in your neighborhood, in your community, that not everyone is going to be able to be vaccinated at the same time. And so that we need to continue really with these efforts, because these are all of the things in combination that are actually going to help us to, one, help keep everyone healthy, to keep people safe, but also to get us back to normal, to be able to do things like reopening the economy, is doing all of these things in combination. And that importantly, as we are health leaders, something to communicate is to continue to advise, how are we progressing? Are we making progress in this? Because, people will obviously then want to know, well, when can we end? When will this be able to stop? And I think you have to be transparent in saying, just as we said, it's going to take time, but if we continue with these efforts, and we know they're hard, we know it's challenging to potentially be away from loved ones, to continue to have to wear masks, et cetera, but these are the things that are really going to help us get to the other side of this. I think is an important message that we have to continue to make.
Well, I'm going to ask us to go into a lightning round now, because we want to go through a lot of other questions. So we have one final question before we take questions from others, and this is a combination question. It really has to do with communicating and understanding that there are different messages and different ways of messaging that might be necessary for different populations or segments of and sectors. So any thoughts about the importance of focusing on building trust in ways, though, where the messages are really focused on a particular population?
There are a lot of organizations doing research on this right now, and some of the research is up on PHCC's website. So I would encourage those of you who haven't checked out the resources section to go check it out. There's some really good information there on messaging. But I would say my 2 cents is the messenger is more important than the message. The message is really, really important, but the messenger is even more important. I think one of the amazing strengths of the field of public health is that if you work in public health, you know the community that you serve, and you know who the community leaders are in that community. That can't be said for every field, but our strength is our collective impact. And so it's not just the person who works at the health department communicating. It can never be that. We know that won't work. It's what other 12, 20, 50 individuals out there reaching all the different populations that you know need to be reached. Are you all coordinating amongst yourselves and saying the same thing? And if that's happening, I think you're doing everything you could possibly do.
I think trust is built with consistency, and we'll also, de Beaumont will be releasing results from our poll that are specific towards Hispanic and Latino populations soon. So watch the de Beaumont website and Twitter feed. We'll be sharing those resources shortly.
And Dr. Grassi, I think you recently released a report that specifically talks about messaging as well as reasons for hesitancy in communities of color. Is that right?
Yes. So Trust for America's Health, in partnership with the National Medical Association, which is the nation's oldest and largest organization representing African American physicians, and Unidos US, which is the largest civil rights organization advocating for the Latino community. We released a policy brief on building trust in communities of color and tribal nations as it relates to the COVID-19 vaccine. And I think an important thing to understand is that communities of color and tribal nations certainly want similar things of health and well-being and opportunity, safety, and other things that we're all striving for. And so when we speak about earning trust, actually is really coming to the table and understanding and acknowledging for communities that there is historical trauma, that there is are legacies of medical experimentation that have happened in many of these communities' history, but that not only is that in the history, there's ongoing discrimination and bias that exists in healthcare and in other services. And that has shaped the experiences of many communities of color. And so understanding, and actually in the materials that the de Beaumont Foundation has released with regards to the messaging and language, not being judgmental of people who have concerns because there's an understandable history but ongoing present-day experience that communities may face. And to recognize that these communities are not homogeneous. They're heterogeneous and really important to partner indeed with trusted community organizations that have worked in, that are part of those communities to deliver messages that are culturally and linguistically appropriate and that are being delivered in places and spaces in which communities feel heard and comfortable. And that you're addressing the concerns that they may have. And to recognize that those concerns doesn't mean that a community won't want to be vaccinated, but really wants to have the information, the data and understanding how the vaccines were developed, understanding the process by which they were developed and who was involved in that process, how you become part of where you fall with regards to the priority groups, and what are the benefits of vaccination. Those are the things that communities are seeking, and it's important that those organizations that you're working with also have the resources, right? And that's one of the things we advocated for as well, certainly from federal funding to get to states and localities to give funding to those community organizations that really have that trust to be able to do this type of work, because often they have been under-resourced to be able to get those messages and do that work with their communities.
That's great. Well, thanks to the three of you. And let's turn to Tracy Siegel from GMMB, who's been monitoring the questions as they've been coming in. And we're going to do a bit of lightning rounds, maybe ask just one of you to answer a question. But of course, if another one wants to weigh in, that's okay too. But we're going to try to go through a lot of the questions. Tracy, why don't you give us our first one?
And John, this is Melissa. I will jump in here. Lauren Rensfesher, if you are available and interested to ask your question, we'll go ahead and call on you first. Lauren, I can go ahead and...
Why don't you ask the question for her so we can keep going? Yeah.
So do you have any tips specifically for employers that want to encourage their workforce to be vaccinated? Some messaging guidance for employers.
I think the message guidance that we discussed earlier, those 4 points, apply equally for employers as they would politicians, as they would health officials. I think for employers, creating a safe space where people can ask questions, I think that could be a real game changer here, because getting questions out in the open so that people can discuss them and have misinformation corrected is going to be critically important.
Okay, let's hear the next question.
Great. We'll go ahead and just narrate the next one to make sure we get as many in as possible. This one came from Jacob Koster. How do you balance messaging the benefits of taking a vaccine with the potential consequences, as opposed to the perceived consequences for not taking it?
Dr. Grazia, you want to handle that one?
Sure. I think as we've been emphasizing, it's while the consequences are real in there, I think as you're seeing from just even polling about the language that really is useful to use is actually talking about the benefits and personalizing those benefits. I'm even doing that within my own community and family, personalizing those benefits to understanding that taking the vaccine, getting the vaccine protects you, it protects your family, and beyond. And so, and for certain populations, as Dr. Smyser had noted earlier, that the messaging might more so resonate as it relates to getting back to normal versus others who are saying reopening the economy. But really talking about those benefits and then addressing if there are concerns about what the misinformation is with regards to vaccine really seems to be the language that helps to drive that kind of change with regards to actually building vaccine confidence.
Dr. Garcia, do you want to maybe just mention for a minute people who might have concerns about adverse events, adverse medical consequences to a vaccine? Is that a major issue for people? How would you answer that question?
Yeah, I think it's important to be, again, very transparent and clear to say that, based on the studies and the trials that have been done, that the risk of an adverse event and seeing a medically significant adverse event is extremely low. But it's also important to explain that, yes, there can be side effects as with other vaccines, but explaining what those side effects are, that you might have soreness in the arm, that you may have a mild grade fever or headache and tiredness, but that those kinds of symptoms actually are indicating that your body's actually working. That's actually responding to and building the protection, building the immunity so that you can actually fight against the virus. And that those types of symptoms go away within a few days. And that those benefits of getting vaccinated far outweigh, those types of the mild symptoms that you might have or side effects from the vaccine, but that really those adverse events that are serious, medically significant adverse events, that's extremely low, and that every study and the trials and the medical researchers that have analyzed that have talked about the safety and effectiveness of the vaccine in that way.
Great, thanks. Melissa, next question,
Thank
please.
you. Our next question is from Rita Obi, and we're going to be unmuting her right now.
Hi, good afternoon, and thank you so much for this webinar. So what I've been seeing quite a bit on social media, and even speaking with my own family members, is the belief that it has been rushed to development. And people are very confident in that. As you know, CERC tells us the first messages they receive are the ones that they're going to hold on to the most. And I will say that early on, even I was hesitant, but then one of our local infectious disease experts had mentioned that the vaccine is actually a coronavirus vaccine, had been in development for over 17 years. Are we looking at pushing that type of messaging? We've heard a lot about how, frankly, from a layperson's perspective, how bureaucrats have removed barriers. They're not buying that. But what they may hear, because that's what I was able to hear, was, no, this didn't happen in 6 months. You know, we've been working on this quite a while. Do you think that messaging would be helpful?
Thanks so much for that question. Who'd like to answer it?
I can tell you what worked in the polling that we did. I think when you start to talk about preparing a vaccine for a virus that we didn't know about, that could get confusing in your messaging. And I think what you need to just kind of stick with is there were no corners cut. The FDA was involved at every moment. We will continue to monitor the safety of the vaccine long after it's been in people's arms, and that, you know, most importantly, the side effects so far have been very mild, and even the most severe side effects occur very rarely and are easily handled. And I think just keeping that, you know, there's an infographic on the PHCC website that walks through the different trials that these vaccines have gone through. They've been tested in tens and thousands of people. And so I think that's a better message than going back to, we've been working on this for, you know, since 2003, because I don't think that's the best message.
Melissa, next question.
Let's see, we'll be unmuting Paul Boyer.
Yes, hello, and thank you. So a lot of the vaccine objections I hear are really related to institutional trust. Tuskegee, disparities in healthcare, politicization of the virus. Should we generally try to move the conversation to the personal rather than offering direct counters to those objections? What would be a good response to something like, why should I believe what the government tells me?
So, an excellent question, and I'm happy to start. I think it's very important to acknowledge the history, because Tuskegee happened. You know, the many instances that we can point to in history indeed happened, and those are concerns that communities have. And so to acknowledge it, one, demonstrates that you are listening to the community and listening to the people that you are really working with and trying to educate about the vaccine, and not being judging in that regard, but then being able to address what are the questions, what are the concerns that they may have, and being able then to address those concerns, but recognizing that we're at the same time as we are working to administer vaccines, this is happening at the time that you're also trying to dispel these myths and also build trust. And that's a challenge, especially in the context of this pandemic. And that's where the importance of partnerships as one strategy is so important. Dr. Smizer mentioned it earlier, the messenger that's actually delivering these messages. And you see, whether it's healthcare providers, you look at polling that even, in the Black community, that personal physicians, nurses really have an important role because they are trusted in communities. And we've seen, for example, historically Black colleges and universities, the medical school presidents who have taken leadership roles in helping to educate, getting out on whether it's through social media or traditional media, to be able to educate communities. So I think it's important not to dispel that history is there. It's important to acknowledge it, but then to also be able to provide the information to explain the safety, to explain the effectiveness, to explain, what the benefits are of vaccination, and to understand who can deliver that message in a way that is trusted, because these institutions have to earn the trust of communities. And one of the ways to do that is through partnerships. And, to understand that those partnerships also need to continue even beyond the pandemic, because the inequities that we have seen started well before this pandemic. And to really help us to getting to ending those inequities, we're going to have to continue those partnerships even well beyond the pandemic.
That's great. Next question, Melissa.
Thank you. And I will just announce that we are coming up on the hour, so we'll probably be able to take just about 2 more, and we'll make sure to document all the others submitted. Let's see. Carmen Navarre, are you available to jump in here? We can unmute you.
Yes, I am.
Please ask your question.
Thank you. I think that you've somewhat answered part of it, but I was concerned about what examples do you have, if any, of best practices for communities of color? I think you've said a couple of things, but I'd like to hear more specifically. Are there places where people have successfully been able to communicate in an engaging way with their communities of color? These are the communities that have the highest rates across the country of infection and death, and also the highest rates of vaccine hesitancy. So best practices, please.
Dr. Gracia?
So I think that it's indeed, again, recognizing that the communities are diverse, and so really recognizing who are the trusted messengers and the community leaders, faith leaders. In tribal nations, it can be the tribal elders. We've worked with, for example, and in our policy meetings have had networks of promotores de salud who are community health workers in Latino communities that really are members of the communities who are trusted in providing health outreach and health education. There are collaboratives like the Black Coalition Against COVID that are using social media, that are doing town halls, the NAACP and Unidos US, who are actively engaged in efforts not only at the national level, but also at the local level through their local affiliates and chapters in doing community events, utilizing radio and PSAs and other strategies to be able to get messages out in utilizing the vehicles of communication that communities find most beneficial, and from messengers, whether it's healthcare professionals, whether it's church leaders or other community organization leaders that are seen as credible and trustworthy in those communities.
And I think we have time for one more question, Melissa, right?
That's right. And I'm going to go ahead and read it out loud just to make sure we have enough time for the answer. This came from Shelby Leonard. How can we address vaccine confidence on a larger scale from a public health perspective? What can we do besides the one-on-one discussion?
Maybe we'll ask each of you to just say your thoughts quickly on that question. Dr. Kastucci, want to start?
I think we need to keep messaging consistent, and we need to get the mayors and everyone talking about this, but this may be very much family member driven. And I know there is going to be a national campaign on vaccination, which we can then leverage off of.
Dr. Smeisler.
Well, we definitely need messages that are tailored for distinct audiences or distinct populations. But I do just keep coming back to, we really need to give equity to this conversation to a lot of other groups and individuals. It's not just public health. So it's community-based organizations, it's community leaders. If we regard this as just our problem to solve, our being those of us in public health, we're never going to get there. So there's a table with 12 chairs around it. One of those chairs should have a public health person in it, and the other 11 should be community members.
And Dr. Gracia.
Agree that the importance of, again, tailoring the messages to the audiences, but even in tailoring those messages, it's actually working in partnership with community to identify what are the messages that will resonate with community. Are we addressing the concerns of the community, and who are the most effective messengers, and ensuring that those messengers have the resources and support, whether it's at an organizational level or at an individual level, to be able to do this work within the community.
Thank you. What a great panel. And I would just add to what the things you said, fortunately, very fortunately, there's going to be a lot of money that's now going to be going out. It wasn't there months ago when it was needed, but Congress just passed a couple of weeks ago another relief bill that will send $4.5 billion out to states, cities, tribes, and territories to work on vaccine-related activities. So I would encourage all of those who are listening to talk to those who will be receiving those grants and think about how you can take some of the messages that have been talked about today and direct and recommend that funding be directed to help to make those appropriate messages, whether that's funding community organizations, community-based groups, groups of color, reaching the populations that are at most risk. Now we have some significant resources that in the coming weeks will be coming out. Well, with that, let me just thank you all. Thanks all of you for these terrific questions. I wish we could have gone through many, many more, but we really try to keep the webinar to just 1 hour in order to make it something that can fit into a busy day for all of you. I want to say a special thank you to our speakers, Dr. Kastucci, Dr. Gracia, and Dr. Smizer. Please go to the website to get more information that represents their knowledge and contributions. It's always good every few days to go back to the publichealthcollaborative.org and send us information that will be useful for our understanding of where the gaps are, and look at the website for the Public Health Communication Collaborative. This is not the last of the webinar. We will be having another webinar in February, so please stay tuned as we set that date. And so again, just thanks to all who helped organize this, and we very much appreciate your participation. Goodbye.